Let's talk about what an addiction is. Many of us have had our own personal experience. We've witnessed others suffer from an addiction, or we've seen in the media portray what they view an addiction as. In this video, I'm going to talk about what we've been trained in the medical model, how we will define addiction in the hospitals, the clinics, and when we use the word. With this, we're going to show the biological underpinnings and why it's relevant to you. Importantly, when we're talking about addictions, we can also be talking about behavioral addictions, but this specifically, we're looking at substances. And so we're going to use examples. We may focus on alcohol, but it can really be any substance. It could be cocaine, cannabis, methamphetamine, heroin, opioids, pills you take, benzos. There's a whole array of substances that people can develop substance use disorders with. When we talk about a medical addiction, one of the terms we will use is we'll use a substance use disorder. That's something we get from the DSM-5 here, which is the guidelines we use to make diagnoses in the hospital within psychiatry. And the importance that'll come in here is they give a whole list of criteria for a specific substance use disorder, and it helps make sure that we're all talking about the same thing. The important thing really comes down to the time frame, and then function and dependence. So when we look at a time frame, we're really trying to see how persistent and inflexible the pattern has become. So with the substance use disorder, we want to make sure this is something that's developed over at least a year. This is something that's ongoing in their life that is not temporary at that point. If we then move on to function, it's how has it affected them in their life and their relationships. So if I am, say my family member is all of a sudden developing this addiction to alcohol, they may have been a very big soccer fan and done pickup soccer every Saturday. It's their favorite pastime. Holding down a stable job. Been in a relationship with someone in a very fruitful relationship. And as this substance use disorder is developing, you see the relationship is no longer so stable because of how erratic their behavior is or because of things changing with the substance intake. They might be drinking on Friday nights and then they're hungover and don't feel like going to their soccer leagues. So they're not doing their hobbies. The relationships are changing. Maybe they're not going to work anymore, or they're losing their job or having trouble at work. And so that's how we see the function of it, is how has the substance intake impacted them in their daily life. And then we also have what we call dependence. So dependence looks at how it's changed the drug, the chemicals affected the body. And so if we use alcohol, for example, if someone drinks alcohol daily for a period of time, when they don't drink alcohol that next morning or that next afternoon, they might go into withdrawal, where instead of the alcohol calming them down, slowing them down, they're all of a sudden shaky. They're sweating, they feel nauseous, they want to throw up, they can't sleep, they're very hyperactive and really agitated. Once we've established a diagnosis of a substance use disorder, we can then break things down into periods of intoxication and withdrawal. Someone who's intoxicated is someone who has a user who's consumed a substance. So this period is specifically when that drug or substance is in their system. And this is important because we can break down what type of substance they're using is going to lead to very different presentations. Different people have different presentations with the same drug as well. So if you have someone who's taking a stimulant, something like cocaine or methamphetamine, you tend to have a very activated person. Someone who has increased energy, hyperactive, very talkative, more in your face, maybe more aggressive, versus a depressant, something like alcohol, heroin, opioids, benzos. These tend to be depressing. So someone might be disinhibited, but they're going to tend to be more like anxiolytic, calmer, sleepier downers. Then you have hallucinogens, which affect the perception of someone. So it's hard to say just by seeing them, but they tend to be responding in a way that is unusual for what you see. They're seeing things, they're hearing things, their world is altered in some way. And so the relevance of this is really, one, we want to be able to identify these periods because of safety concerns. When someone's intoxicated, we don't know how that's affecting their specific behavior that might put you or themselves at risk, including risks of overdose. Two, we want to be able to identify these because these are important areas of when we don't want to intervene when we're doing psychological or therapeutic interventions. We want to make sure that we're outside of a period of intoxication when we're intervening. After a user has gone through the intoxication period, the chemical will leave their body and they'll likely enter a withdrawal period. This is after their body and their brain has become accustomed to this chemical to where it sees that as normal. And so when we remove it, the body starts freaking out. There's a lot of stress and there's a huge change that the body's not ready for. And it's very specific to what chemical it is the user's taking. If it's something that's more activating, like a stimulant or cocaine, that chemical normally makes them feel very energetic. So when it leaves and they're going through withdrawal, they're going to feel very lethargic, like tired, and just want to lay around all day. If it's something more like alcohol that can be calming, actually help people sleep, it can actually do the opposite, where they'll feel very agitated, anxious, not sleeping. And it's important that each of these chemicals, they're going to have different time periods of when they enter withdrawal. Some of them are much closer when they take the substance, like a couple hours versus a couple days. Some of them will last also days or weeks. The period can last for a while. And when we look at the withdrawal period, I think it's helpful for us to understand that some things like alcohol can be dangerous and we want to supervise in a medical setting. That's why we might admit someone to a detox or bring them into the hospital to give them a medication to make sure that they do it safely. But all of them, we can make people more comfortable and we can see as an important time to intervene and start treatment. Sometimes we can wonder, why would someone keep using this drug? The reward pathway specifically looks at dopamine as a chemical and the area of the brain called the nucleus accumbens. This is something that over evolution we needed. If you found a food that was very rich in nutrients, like berries, you want something in your brain to say that that is good, that that's important, to make it very, very strong and pleasurable so that you will remember everything about it and you'll be able to find more of it. And so we've evolved over time to really be able to locate things that are really important for our survival. And it releases dopamine to tell us it's important. The problem comes is that these substances, these drugs, that when we take them, they use the same pathway, but they're not so useful for our survival. So we now think that it's the most important thing. It sends these chemicals that are much stronger, and we think that there's nothing else that could be as important as that. This chemical has hijacked their brain to make it the most important thing in the world. We're also going to see changes on the chemical signal pathway. This is from recurrent chronic use. When someone continues to use a substance, our brain, our biology will actually change. So if we want to look at a specific example, we could talk about alcohol. We could say alcohol sends a calm signal. It acts on the brain to send a calm signal to the next step. And so if we continue to drink alcohol day after day after day, our body's receiving this calm signal at a much higher level than used to. And so what will happen is we can't be calm all the time. Our brain needs some sort of balance. The receptors that receive the signal to stay calm are going to start disappearing. There's going to be less and less of them. And as such, we're going to need more and more and more alcohol to maintain that same level of calm. In addition to needing more and more, what happens is, say you stop drinking, your brain doesn't have the ability to maintain that normal signal you tend to have on a day-to-day basis, so you're not going to send that regular calm signal. Your brain's receptors are all gone, and there's going to be a huge amount of stress. You're actually going to be very not calm, very agitated, and hyperactive at that point. Hyperactivity also perpetuates that same process, because the only way for them to avoid that feeling or that problem is they continue to drink and drink and drink more and more and not stop. Now, to wrap all of this up, we've talked about what the medical definition of a substance use disorder is so that we can understand when we want to treat from a medical standpoint. We also then have talked about when intoxication and withdrawal are, so we can see how someone's behavior may change when they're taking the chemical and how it may change when they're withdrawing off the chemical as well. We've then looked at what are the biological changes that have been happening in the brain that keep perpetuating this kind of behavior. And the importance of this is so that you can understand what they're going through to help us come up with a game plan to help intervene. This has been another episode of Conversations with AcroPsych, hosted by Dr. Matt Campbell. Thank you so much for watching.
Please leave a comment below for the topics and resources that you want to hear about as our next general educational topic. This video and all information put forth is for general educational purposes. It does not form a doctor-patient relationship. It does not provide any medical advice or individual care. It is in no way a replacement to your medical professional, and we recommend seeking appropriate professional assistance with all your healthcare questions and needs. For any psychiatric or medical emergencies, or any safety concerns at all, please utilize appropriate emergency services. This includes 911 or going to the nearest emergency room. For needing to speak to a mental health counselor, there is 24/7 hour hotline that you can reach a crisis counselor.